Hello, everyone. Welcome to another review class for our LAM students. And we are very proud to have with us join from Manila, Ma'am Trix Guevara. Good afternoon, Ma'am Trix.
Good afternoon, Doc. Good afternoon, everyone.
Yes, today we shall be reviewing our knowledge on a very important extraordinary vessel called the Dai Mai, or the girdle or belt meridian. Let's start the ball rolling with the first question. Belt or the Dai Mai influences the what? What three areas of the body?
It influences the genitals, the waist, and the hips.
Okay, so we shall be focusing on these three. And the opening point of the belt meridian is,
Gal, uh, Gallbladder is 41.
so if you have an opening point, you also have a coupled point. And what is that?
Triple burner or Sanjiao 5.
Yes. And if you remember, this is actually associated with the Yangling vessel or the Yang Wei Mai. Okay, fill in the blanks. The belt meridian harmonizes the blank and blank excess patterns.
It harmonizes the liver and the gallbladder excess patterns.
Yes. The belt meridian versus what pattern in the genitals?
Disperses damp heat in the genitals.
Belt meridian helps with impairment of blank channels due to blank problems.
Impairment of the leg
Yeah,
channel due to circulation
yeah. So I
problem.
pretty common, especially among the elderly, no? Yung wala masyadong exercise. They will have cold feet or the muscles are tense. The belt meridian affects the chi in the what channels that causes blank weakness and atrophy.
Affects chi and the stomach channel that causes leg weakness and atrophy.
Okay, so this is something for everyone. So if you notice something is a bit off with your leg, then you might want to take a look at the stomach
Mm.
and use the belt meridian. The belt meridian helps with blank deficiency, leading to undernourishment of the joints and sinews. So this is, I think this is a bonus because um, of the term undernourishment. So there is a deficiency in blood. So the question is, what particular Zhang are we talking about?
Uh, it helps with the liver blood deficiency, leading to undernourishment of joints and sinews in the gallbladder 14.
That's why we need to use as an opening point GB41. You should try this. I tried using this. It helps. Okay, the belt meridian is located where particularly?
The lateral side of the lumbar region.
Okay, lateral lumbar. What are the points in the belt meridian?
GB 26 to 28, stomach 30, and GB 41.
Of course, GB 26, 27, 28, stomach 30, GB 41. So yeah. What vessel clears all physical
Mhm.
and emotional obstructions? And this is why I love this extraordinary vessel so much, especially if the patient comes with an emotional issue, no? So it actually clears obstructions, no, both physical and emotionally, from lower warmer or lower burner stagnation, dampness, cold, and heat. What is this?
The Dai Mai,
Or the
the
belt
belt vessel.
or the girdle. What is the
Vessel
coalescent
girdle.
for the Taimai belt vessel? Primary coalescent.
GB 20,
Yeah.
GB 26.
Yes, gallbladder 26. What is the coupled point again?
Sanjiao 5.
What is the master point for the Taimai?
GB41,
What is the most young meridian of the body?
the Dai Mai.
So probably this is something that we need to remember, no?
Mm.
Especially if the patient who has so many issues.
Emotional.
Emotional, then sumasakit yung balakang, no? The legs. Young meridians are often used to what?
To treat disorders along the pathway of the meridian.
Yes. Okay. What are the reinforcing point groups in the Dai Mai? I think you mentioned this earlier. What are they?
Uh, do 12, ladder, ladder 13, ladder 42, do 8, ladder 18, ladder 47, do
Okay.
4, ladder 23,
Yeah.
ladder 52.
So there seems to be an involvement of the outer back shoe, no? Mm.
Yes.
So these are the points. So there are actually four groups. The first group consists of 212, bladder 13, and bladder 42. So 13 is the back shoe of the lung, and if you add 29, that becomes the outer back shoe, which is bladder 42. And I usually needle this if a patient comes with an emotional issue, particularly grief, depression. And
Mm.
then the second group reinforcing would be 2-8. And then this is liver, no? Bladder 18 and bladder 47.
Mm.
Bladder 47 is the outer back shoe of the liver. Then we have 2-4. Everybody knows where 2-4 is. And it's so easy. Just one line, one level, no? Bladder 23. So this is kidney, this is lung, this is liver, this is kidney, and the last one would be what? Bladder 25.
G 25 and 57.
Yes. 2-3. Okay, what is the digestive treatment for Dai Mai?
Uh, to needle GB41, needle GB26, use Moxa on Ren 8. Needle or Moxa, spleen 15, stomach 25, and kidney 16. And then needle Sangel 5.
Yeah, so okay. I remember the points, no? The opening would be GB41. The confluent point is San Chiao 5. So you needle this last. So just follow the order. No? Your Moxaren 8. I would usually use the abdomen. What's this? Um there's a term for it. The Moxa box pala. It's safer.
Moxa box.
Moxa box.
Moxa box.
Yes. It's available. I think the two suppliers have it. Okay, what is the 4-point low back pain treatment? So maybe this is something that everybody would want to try, especially amongst people with emotional issues.
Uh, we first palpate the GB26.
Mhm.
So if it's reactive, treatment is likely to be effective. And then needle GB41, GB26, needle or moxa do 40, needle bladder 23 and 52, and wato chiachi,
Yeah, the
and
what?
then needle sanchao 5.
Yes. So the first would be GB26.
Wato,
If reactive,
wato.
the treatment is likely to be effective. No? Then GB,
Okay.
and then you only needle GB26 if it is reactive. Then you needle or moxa do for
Hmm.
bladder 23, bladder 52, the Wato Tiachi as needed. Wato Tiachi, diba? It's thoracolumbar, no? From T1 to lumbar 5. Okay, needle San Xiao 5. Yeah. Okay, what about the lower warmer treatment for Thai Mai?
Lower warm. Needle GB41, the needle GB26, stomach 30 and REN 2, and then needle GB27, 28, spleen 12, and kidney 11 as needed. And last needle, Sanjalfa.
Okay. When you say as needed, it is understood that you have to palpate, no? So if there is tenderness, then you have to needle. Next, what are the two trajectories of the Thai Mai?
First, the kidney and spleen. So, needle do 4 below L2 and REN 8. That's in the umbilicus. And then do 4, bladder 23, bladder 52, and gallbladder 26. Next, the spleen 15, stomach 25, kidney 16, and REN 8. For the lower warmer, it's do 4 to gallbladder 26, down to REN 2, then needle do 4, bladder 23, bladder 52, gallbladder 26,
Gallbladder,
and the gallbladder 27, gallbladder 28, spleen
okay, 6,
12, stomach
28.
30,
Hmm.
kidney 11, REN 2, and liver 12.
Okay, what a very complex trajectory. Belt lang pala. What are the zones associated with the Thai Mai?
uh, Lateral belt or the lower back.
This is particularly common, no? What do you think so? What can you say? Diba? Lateral back. And usually among women. Oo.
Yes,
Pasyente
especially when we have the monthly period.
Actually, I have a patient. She was complaining of she's single at 68, 68, 69. She plays
Mm,
mahjong a lot. She came in with stiff neck.
mm,
However, she would, because she plays mahjong, so sleep is
mm,
not very complete kasi she wants to win all the time. She has money kasi. So, and I remember she was like pointing talaga um, sa lateral part of the lumbar. Parang sa
mm,
L2, L3, ganun. Then lateral. I might want to try this, di ba?
mm,
Okay, these are general indications for what extraordinary meridian. So all lower warmer stagnation and accumulations. So when there is stagnation, there is always pain. So alam
mm.
na natin what is involved here, especially if you have mastered the components of the lower warmer, no? Accumulations means nag-accumulate yung mga chi doon, blood, so sumasakit. So what is this channel?
The Dai Mai channel.
Course. Okay, then here's another one. These emotional indications are for what extraordinary meridian, letting go of negative emotions, which is very, very important, lethargy, trauma, indecision, guilt, stagnation, inadequacies. So again, it's a timeline. The following women health indications, okay, opens the lower warmer, moves the liver chi, resolves damp heat and cold in the lower warmer. You know naman what happens when you have damp heat in the lower warmer, no? May mga discharge. Tsaka
Mm,
may mabaho. No, not discharge, I'm sorry. Usually it's UTI. Yeah, yeah.
oh,
It's coming back now. I remember she used to have that pala. Okay. Good na lang. This is our topic for today, our review. The uterus is influenced by what?
by the Dai Mai belt, Dai Mai or belt vessel, the Du Mai or the governing, and the three treasures, the Qi, Qing, and blood.
Yes. Taimai, Tumai, and the three treasures. What is the purpose of the Taimai?
To, it clears all obstructions from the lower warmer. Um, for physical and emotional stagnation, dampness, cold, and heat.
Yes. What are some points used to clear all obstructions from the lower warmer? Physical and emotional stagnation, dampness, colded in the Dai Mai. Can you mention them? Ay, ito na yung gagamitin ko Google.
Do for do for bladder 23, bladder 52, gallbladder 26, spleen 15, stomach 25, kidney 16, ren 8, GB 27, GB 28, spleen 12, stomach 30, kidney 11, and ren 2.
Okay. I don't think you need to use all of them, no?
Mm.
Try ko nga yan, yung iba sa tenga. Siguro 4-4. The rest would be body. These key symptoms are linked to what channel? Leukorrhea, prolapse of uterus.
The Dai Mai.
What is called the vessel of consolidation.
Dai Mai prenatal.
Yes. Di prenatal trajectory. So that means you need to
Uh,
name this para maganda yung conception niya, no? Para especially for women with miscarriages, no? Mm.
ren 8, kidney 16, stomach 25, spleen 15, GB 26, bladder 52, bladder 23, and D4.
Yes. Okay. What are the Dai Mai prenatal pathologies? That means before the woman gives birth, no? Before the mother gives birth.
Urogenital, gyno, reproductive, chronic postnatal issue from spleen, unable to maintain Qi or blood, Shen disturbance originating in the first cycle of the 7 and 8.
Okay. Treatment principle for Dai Mai prenatal.
Um, Exchange fluids in the lower jiao to stop loss, maintain integration of the CRD
Yeah.
for their upward movement.
Chong Rendu, no? The Chong, that was our topic last time. So Chong Rendu. Vessel of latency, draining Daimai, considered the luo of the 8 extraordinary vessels.
Postnatal diamond.
Daimai postnatal. What is the trajectory of the Daimai postnatal?
GB 27, 28, bladder 3. Um, LSC added liver for 13 as a starting point. Drains the diamine.
Okay. Pathologies. What are the Daimai postnatal pathologies? That means after ano na to, pag nanganak na.
Left and right disparity, hemiplegia, up or low paralysis, lower but functions upper,
Hmm?
obesity, fat gluteal or abdominal, similar to luo, things body can't deal with postnatal level, deposited back to prenatal in the abdomen.
Yeah.
Gallbladder link between pre and postnatal.
So that means there is really a need to drain the Daimai, no? Okay. Postnatal treatment, the Daimai postnatal treatment principles.
Drain damp cold in the lower jiao. Drain damp heat in the lower jiao.
So you drain everything, all the damp in the lower jiao, lower tiao. So what are the classic signs and symptoms of the Daimai? Like, yeah.
Bloated abdomen, sagging sensation in waist as if sitting in cold water, dysmenorrhea with bloody discharge,
Mm.
headache, lumbar pain after lifting a heavy object, swelling, edema, watery eyes, pressure on eyes, glaucoma cataracts, numbness and shaking of hands and feet, arms and legs.
Okay. Sandali lang. Nag-remind yung pala bukas. Hindi niya alam, ready na ako sa mga points niya. Okay. Cheating, no? Okay.
It just so happened that we're discussing.
Yeah, so I like it. Kaya
Yeah,
timing lang. Kasi hindi nakalimutan
yeah,
talaga.
timing.
Bloated abdomen, yes. Yeah, she also had watery eyes. Opening point again.
GB 41.
Hmm. So it gets rid of sentimental garbage by crying. So what if umiyak siya, di ba? It's very therapeutic.
Mental garbage.
Using 5 pillars prior to treatment. So what are these pillars? The
SCM,
sternocleidomastoid, yeah. The diaphragm, paravertebrals, the psoas, rectus,
diaphragm,
abdominis. Mm. So that means
gouache.
you have to cup them or gua siya.
Hook up our
Siguro after, no? Pero bakit prior? Okay. Okay, consolidating. Okay, what is when is there a need to consolidate prior to draining?
when the past dreads letting go.
Yes. And the patient dreads letting go. So kailangan niyang mag-let go pa. Okay. Can you tell us how liver 13 can benefit the patient?
Uh, it releases memories. Releases blood used to store memories. It drains damp and strengthens the spleen.
Okay, especially bad memories, no? Mm.
Mhm.
May bad memories yung pasyente ko. Okay, GB26. Ay, oo.
Uh, Stop leakage. Release belt channel at the local opening point.
Yeah, to stop the leakage. GB27. Remember, GB26, 27, 28. So, yung isa stops the leakage. Ito naman.
Release damp heat. It's an analgesic point for leukorrhea, explosive diarrhea.
Yes. GB28.
Uh, to treat stagnation of being stuck in the past, reminds uh, patient what matters is present moment. Treats them cold in the lower gel.
Nice siya, no? I hope somebody can relate here. What matters most is the present moment. So for those who cannot let go
Present
of the
with
past, so kailangan mo gamitan ng
past.
GB27 to drain the bad memories. 26, 27, 28. Buti pa lahat na lang,
27,
no?
28,
Okay, like if you do
26
pulse
to
diagram,
28.
what do you expect to find when oo, gamitin ko pala bukas. Tinan ko. Like the Dai Mai pulse. Like,
Vibrate at 1.
okay, nagva-vibrate sa kwan. Okay. The pulse, the do pulse. Okay.
It vibrates.
Okay, these are indications like if na-notice mo there's vibration at the kwan positions, then you have to do Dai Mai. What's it Dai Mai? Yeah, Dai Mai pulse. Okay. So, when is there a need to use the do? Ano yung pulse mo dapat?
Superficial.
Nagva-vibrate.
It vibrates.
Yeah.
All three
Okay,
superficial.
vibrates all three superficials. Okay. Two. Kasi yang na yang ang two, di ba? Pero pinaka-yang ang Taimai, di ba? Yan.
Mm.
What about, like, if this pulse, if you feel this pulse, there is a need to focus on the REN. So, anong klaseng pulse ito?
Uh, a deep pulse on all, vibrates on all
Okay.
three
Yung deep
levels of
pulse,
the.
all three nagva-vibrate. Okay? So pag superficial,
Mm.
nagva-vibrate all three pulses. That's REM. Kung doon lang sa Kwan nagva-vibrate, Dai Mai. What about Chong pulse? Grabe naman to. Masyadong deep.
Uh, vibrates on all three
Ah, okay. Yeah. Moderate siya. Moderate.
at the middle.
Mm.
Moderate.
A middle pulse. Okay,
Mm.
so from superficial to deep, you have the two, then we have the Chong, and then the Ren. No? Oh, remember Yang Wei Mai? Yang Linking? Kalimutan na.
Nakakalito kasi.
Grabe, no? Sana lahat may pasyenteng ganyan. So the pulse that will really make you use the Yang Wei, or that means you have to look at Yang Wei.
Uh,
Yang Linking.
so
Mm.
it vibrates at Sun and Quan at a superficial level.
Okay. So kung Kwan lang, should be Dai Mai.
Uh,
Tatandaan pa ba natin yan? What about Yin Wei?
it vibrates at the Guan and Shi at the deep level.
Yes. Diyos ko. Okay, Yang Chao. Yang Heel, no? Remember Yang Chao, Yin Chao? Mm. Yang Chao
It
Paul.
vibrates at the Sun.
Okay. Pag nag-vibrate sa Kwan, ano yon?
Uh, Dai Mai.
Okay, Yin Chao. Interesting.
Yan siya. It vibrates at the Shi.
Okay. Kaya pala ano, napansin ko si
But
Doktor.
it's all vibrating.
Oo, parang pati kamay niya parang daliri niya parang ina-anticipate niya nagwa-vibrate. Okay, what's the needle technique and duration for Thai Mai?
To tonify patients 40 minutes after the opening points.
Yeah. So 40 minutes after the opening. So ibig sabihin,
40 minutes after.
kasi you'll be needling many points, di ba? So after, what's the opening point again? GB41, right? Pag
41
naglagay-lagay ka na, so pag natapos ka, okay.
minutes
The
after.
moment you needle pala, yeah, okay. GB4. Warning for Thai Mai. Oh, caution.
Morning. If drained or used incorrectly, it wastes Jing. Most dam can be treated by strengthening the spleen.
So I think it's safer to just strengthen the spleen. Baka mamaya
Mm.
nagka-Jing S, Jing deficiency pa yung pasyente mo. No?
Nagkamali.
Oo, nagkamali. What body tissues and organs are influenced by Dai Mai? I think we discussed this earlier. May mga dagdag lang.
Genitals, waist, hips, uterus, and bladder.
Yeah, also the
Uterus.
liver, gallbladder, spleen, stomach, bladder, divergent channel. Okay, what organs does the Dai Mai influence?
Gallbladder, liver, kidney, spleen, stomach, and bladder.
Ay, kasama stomach? Okay. Sige. What are the three
Okay.
general functions of the Dai Mai? So it's here. Harmonizes the liver and gallbladder. So it's very effective for liver qi stagnation, liver fire, gallbladder heat, resolves dampness in the lower tiao for excessive leukorrhea, urinary problems, and regulates qi in the leg. Okay, for cold legs and feet. What happens when the thigh belt is too tight?
Uh, it leads to stagnation of the leg channel, causing dampness.
Yeah, so it is an excess condition. What about if the thigh belt is too loose?
If it's too loose, it allows the spleen and kidney chi to sink of leg channels that are not restrained. Dampness
Okay.
will infuse in the lower back.
So it's a deficiency condition. Point prescription for liver
Okay.
cheese stagnation.
GB41 and Sanjal 5, liver 13.
Okay. Di ba kanina sinabi mo, liver 13 has many, many, like, it also tries to make you forget the bad memories, no?
Mhm.
Okay, point prescription for liver fire and gallbladder heat.
GB41 and Sanjal 5, and liver 13. GB43
Okay, what do you expect to find
to
on the
clear
top
heat.
for liver fire and gallbladder heat? So obviously you will have a very red sides, no? And the coating would be the coating, no ba? Yellow on the sides, no?
Oh, wait.
Yeah. Liver fire and gallbladder heat.
Gallbladder.
Bitter
Yeah.
taste.
Yeah, gallbladder.
Point prescription for
Or
weight.
usually, di ba, one side pag gallbladder?
Yeah, one side lang. So it's obviously gallbladder pag one side lang. Okay, point prescription for atrophy waist syndrome. Yung mga may mga ALS, mga Guillain-Barré, no?
Mhm.
So these are the points.
Dai Mai.
If you notice, inuuna pa natin yung GB41 and Sanxiao 5, di ba? Opening and coupled. So followed by GB26, your favorite. Stomach 30, stomach 36, kidney 11 to 4. What is the trajectory? Inulit na naman. It starts in the hypochondrium at liver 13, encircles the waist, connecting
Ayan.
GB26 to 28. It connects at the level of L2 with the kidney divergent channel. So may kinalaman pa rin kay kidney. Point prescription for a full pathology of the Dai Mai, so excess. So these are the points. Kasi excess siya, di ba? Um,
Mhm.
GB41's on GB26, REN 3, stomach 28, and spleen 9. Kung empty condition, this one plus GB26 again, then REN 6,
Yes.
220, bladder 23. What are the symptoms of a full Dai Mai pathology?
Vessels becomes too tight and is no longer harmonized.
Okay.
We see fullness and distension in the abdomen. Back feels as if sitting cold and clammy sensation experienced in cold damp by
Yeah, I remember my patient telling me na pag gumagalaw na daw siya, nawawala na yung pain. So
cold
that
damp.
means when she wakes up, like when she starts moving around, no? So dampness,
Mm,
back soreness. Okay. What is the main gynecological condition treated through the Dai Mai?
leukorrhea.
Yes, because of dampness. Point prescription for excess gynae condition in Dai Mai, yung leukorrhea. So as usual, you will have GB41, Santiao 5, andyan naman si GB26, REN 3, stomach 28, spleen 9. So you have to memorize this excess Dai Mai. Point prescription for deficient gynae condition in Dai Mai. Spleen, kidney, cheese sinking, no? So GB41, Santiao 5 pa rin, si GB26. But this time you have to, I think we already mentioned this earlier, no?
Uh, we
Mga
add
formula for.
bladder 20 and 23.
That's why it's so important to distinguish between a deficient and an excess condition. Now, what is unique about the Thai Mai?
It is the only horizontal vessel encircling the channels in the abdomen. It divides the body into two halves, the upper and the lower.
So it's very easy, especially if the patient tells you ang pain niya doon lateral sa lower back, lateral ng konti. Hindi naman, parang ano lang, mga too soon away from the midline. What channels are influenced by Thai Mai? Again,
Gallbladder, liver, bladder and kidney, stomach and spleen.
Yeah, kidney divergent channel. Clinical applications of the Dai Mai.
Full empty pathology, modern stress disorder, harmonize liver and gallbladder, regulate chi circulation in the legs, resolve dampness in the lower TL.
Okay. Iba pala talaga yung modern stress disorder, no? What particular type of conditions can the Dai Mai harmonize?
Full patterns between the liver and the gallbladder, such as liver chi stagnation, liver fire, and gallbladder heat.
Distinctive features of gallbladder heat.
On the side of the body, bitter taste in the mouth, and easily angered.
Yeah. Distinctive features of liver fire. Ito fire na.
Um, Red tongue with yellow coating, full, wiry, and rapid pulse.
Mm.
They're downright irritable.
Yeah. Hello.
Due
Yeah.
to
Overconsumption.
overconsumption of
It's still the diet, no?
mhm,
It's always the diet first. And sometimes we would like to believe that it's the diet that makes you feel irritable. Diba? Okay, distinctive features of liver chi stagnation.
the irritable, distension in the hypochondrium, chest, or epigastrium, depression, moodiness. Tongue may be normal, but with a wiry pulse.
Okay, so don't always look for abnormalities sa tongue, no? Sometimes they may be normal, but the symptoms talagang leading to kuan. And then the pulse talaga is very will give away the pattern. Okay, treatment of fullness, distension of the lower abdomen, often seen in liver chi stagnation. We use the following. So here, no, gallbladder 41 and Santiao 5, your favorite liver 13, and of course, we always want to add liver 3. Yun lang po, no? So napaka-importante yung opening points, no? I probably try that
Mhm.
tomorrow. GB41 and Santiao. Treating temporal headaches in the presence of liver fire or gallbladder heat. So,
GB41 and Sunshine River 13, GB43.
okay, you have the Ying Spring, no? Ying Spring points are very good for clearing the
Yeah.
heat. How may dampness manifest in the Taimai? Or how, yeah. What are the symptoms that you would look for? Hello? There will be,
Urinary.
yeah, urine,
Hello,
yeah.
Doc.
Oo, medyo humihina ang signal, no?
Hello.
Can you hear me? Hello?
Uh,
Yeah,
Difficulty or burning. Hear you.
yes. That's very, very like damp heat. Okay, what about full condition relating to dampness? We discussed this already earlier. Hello?
Um,
Yeah.
so if Dai Mai is too tight, hello? Yeah.
Yes.
If Dai Mai is too tight, leading to stagnation of the leg, causing dampness.
Yes. Stagnation of the leg channels. Kaya nagmamanas siya, no? Yun. Empty condition naman, the thigh is too slack, allowing the spleen and kidney chi to sink, and the leg channels are not restrained. So the dampness will infuse in the lower burner. No? What Zangfu patterns might be involved when treating dampness in the lower burner?
Damp heat in the bladder, damp heat in the gallbladder, liver, and damp heat in the liver and gallbladder.
Yes. What symptoms are manifested in the case of damp heat in the liver and gallbladder? What will you ask the patient?
Vaginal discharge, and
O basta
if they have
yeah, itching genitalia. That's the time I regulate chi in the legs.
uh, 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 it encircles the leg channels, and if chi flow is impaired in the Dai Mai, it will also
Mahina yung signal mo. What are symptoms of irregular circulation of chi in the legs due to Dai Mai impairment?
uh,
Hello.
tense at the outer leg muscles.
Okay. Cold legs
Hello.
and feet, purple feet, tense outer leg muscles. What is the liver connection to
Okay.
symptoms of
Tense.
what is the liver connection to symptoms of irregular circulation?
Liver blood nourishes the tendons, and in this case, it it is not moistening the sinews.
Okay. Lack of nourishment. No? Dai Mai can be used to treat atrophy or Wei syndromes due to
Dai Mai, along with the Chong and
yeah. Ang hina ng signal. What does the ancestral muscle refer to? Are you still there?
Yes, hello, Doc.
Continue. Is it really? Parang hina ng... Okay, let's continue. What does the ancestral muscle refer to?
Yes. The rectus abdominis plus erector spinae and erector.
Yeah. What are important characteristics of stomach 30?
The ancestral muscle has its insertion here, and it is a strategic intersection point of Dai, Dui, and Chong.
Great. What points can be used to strengthen the thigh and stomach channels in the case of multiple sclerosis, for example?
Oh.
Ito na. GB41, stomach,
Gallbladder 41 and central 5,
then,
G7 and Ren 4.
yeah. So try to remember this. Maraming may MS ngayon.
Adu 4.
Yeah. So ano pala, no, pag MS,
Yes.
use the dye. The full condition of timeline, mom tricks,
It's no longer harmonized.
yes.
As we see, yes. Hello, Doc.
Yeah, yeah, yeah.
There's fullness and distension in the abdomen. Back.
Yes. So the vessel becomes too tight and is no longer harmonized. We see fullness or distension. Back feels as if sitting in cold water. Fullness, distension, edema, cold, clammy
Mhm.
sensation experienced in cold damp B. How is the water referenced in the full condition of the Dai Mai?
Could be reference to the water phase in the kidney yang deficiency
Okay. How does Machocha
where a
suggest?
person may be for heaviness. A
Yeah.
deficiency.
Continue. Umuulan kasi. Sige. How does Machocha suggest to treat full pathology of Dai Mai? So it's the same, no? GB41 and Santiao 5, also GB26, CV3, stomach 28, and spleen 9. Walang pababago. For empty pathology, what causes it? Chi deficiency and the vessel being too slack. When it is slack, the chi cannot rise and the organs prolapse or sag. What does an empty condition of the Dai Mai manifest as? It's pretty obvious. There will be prolapse, hernia, or Way syndrome, and also miscarriages. Remember that a fetus depends on the kidney, ren, and Dai. If the Dai is slack, the chi will not rise to give the fetus support. So this is something that we should remember, no? How does Machocha suggest to treat empty pathology of Dai Mai associated with empty conditions of Ren? So still the same formula, GB26, CV6, GB20, bladder 20, and bladder 23. What does a clinical scenario of modern stress disorder appear as? It's a combination of rising yang symptoms with cold conditions or the yang shu, yang deficiency conditions. The yang remains in the head and the chest and is prevented from returning to wanderlust. So it's like cold feet, but but the head and chest are warm. Okay. What points can be used to begin the communication between the upper and the lower? GB41 and Santiao 5. And the last one, what is the Daimai important for in the case of gynecological disorders? Mom Trix, can you answer this? It's leukorrhea. Okay. So thank you so much.
Yeah, look correct.
Mm. Uy, sorry very problematic yung internet. Can you hear me, Ma'am Trix?